Your lower back, known as the lumbar spine, is a very important part of your body. This section of your spine is made up of 5 large bones, known as vertebrae, stacked carefully. They work hard every day to support much of your upper body's weight. Think of all the lifting and carrying you do. Your lumbar spine makes this possible. It also gives you the flexibility to bend forwards and backwards, and to twist from side to side. This area is truly crucial for everyday movement and function. So what is lumbar spine surgery? It sounds quite serious, and it is a significant step. Essentially, it refers to any type of operation performed on your lumbar spine. These surgeries aim to fix problems causing pain or other symptoms. Doctors usually consider surgery when other treatments have not worked well enough. These less invasive treatments might include medication to reduce pain. They might also include physiotherapy to strengthen muscles, or they could involve injections to calm inflammation. Surgery is often a last resort for persistent issues. Why might someone need this type of operation, you ask? The primary driver is usually persistent, severe pain. This pain can make daily life very difficult indeed. It might stop you from working or enjoying your hobbies. Sometimes the problem isn't just pain, it could be weakness in your legs. You might experience numbness or tingling sensations. These symptoms often mean nerves are being squeezed or irritated. When conservative treatments fail to bring adequate relief from such debilitating symptoms, surgery may then be considered a necessary intervention to improve your overall quality of life. The main objectives of lumbar spine surgery are quite clear. Firstly, the surgeon wants to relieve the pressure on affected spinal nerves. This is often the key to reducing your pain significantly. Secondly, the surgery aims to restore stability to your spine if it has become unstable. Another important goal is to improve your ability to move. This can lead to an increase in your daily activities. Ultimately, the aim is to help you get back to a more comfortable and active life. It's about improving your function and reducing suffering from chronic back conditions, enhancing your overall well-being. One very common reason for lumbar spine surgery is a herniated disc. Your spinal discs are like soft, rubbery cushions. They sit between your vertebrae, acting as shock absorbers. Sometimes the soft inner part of a disc can push out. It pushes through a tear in its tougher outer layer. This is what we call a herniated or slipped disc. If this bulging disc material presses on a nearby spinal nerve, it can cause a lot of pain. This pain can also travel down your leg, a condition many know as sciatica. It can be quite sharp and debilitating. Another frequent culprit is spinal stenosis. The word stenosis simply means narrowing, so spinal stenosis refers to the narrowing of the spinal canal. Your spinal canal is the space within your vertebrae. Your spinal cord and nerve roots pass through this canal. If this space becomes too narrow, it can squeeze these delicate nerves. This pressure can cause pain, numbness, or weakness. Often these symptoms are felt in the legs, especially when standing or walking for a while. Bending forward or sitting down might offer some temporary relief. Degenerative disc disease is also a significant factor. This condition is not truly a disease in the typical sense. Rather, it refers to the changes that happen to your spinal discs as you age. Over many years, your discs can lose water content. They can become thinner, stiffer, and less able to cushion the vertebrae. Small tears can develop in the disc wall. Bone spurs, which are tiny growths of bone, might also form around the affected disc. All these changes can lead to chronic lower back pain and stiffness, sometimes requiring surgical attention. Other conditions can also necessitate lumbar spine surgery. For instance, spondylolisthesis is a condition to consider. This occurs when one vertebra slips forward over the vertebra below it. This slippage can put pressure on nerves and cause significant pain or instability. Sometimes, traumatic injuries like fractures to the vertebrae might need surgical repair. Spinal deformities, such as scoliosis in some cases, or even infections or tumors affecting the lumbar spine, though less common, might also require a surgical approach to correct the problem, alleviate pain, and restore proper spinal alignment and function for the patient. A common type of lumbar surgery is called a discectomy, or sometimes a microdiscectomy. This procedure is often used for herniated discs. The ectomy part means removal, So, a discectomy involves the surgeon removing the portion of the disc. It's the part that has herniated or bulged out. This takes the pressure off the compressed nerve root. A microdiscectomy is similar, but uses a smaller incision. The surgeon uses a special microscope or magnifying glasses. This minimally invasive approach aims for quicker recovery and less tissue damage, helping you heal faster after the operation. Another procedure you might hear about is a laminectomy. This surgery is frequently performed for spinal stenosis. The lamina is a part of your vertebra. It is the bony arch at the back of each vertebra. It forms a roof over your spinal canal. In a laminectomy, the surgeon removes this lamina or a part of it. This removal creates more space within the spinal canal. By making more room, the pressure on the spinal cord or nerve roots is relieved. This can significantly reduce symptoms like leg pain and numbness associated with the narrowing. Spinal fusion is a more extensive type of lumbar surgery. The goal here is to permanently join two or more vertebrae together. This stops movement between them, which can reduce pain. Fusion is considered for problems like severe degenerative disc disease. It's also used for spondylolisthesis or spinal instability. To fuse the bones, the surgeon uses a bone graft. This graft can come from your own body, autograft, or a donor, allograft. Sometimes synthetic bone graft material is used. Metal plates, screws, and rods are often used to hold the vertebrae together while they fuse. There are also other, sometimes newer, surgical options available. For example, artificial disc replacement is becoming more common for certain patients. In this procedure, a damaged disc is removed. It is then replaced with an artificial man-made disc. The aim is to relieve pain while maintaining more natural motion in the spine. This is different from a fusion, which eliminates motion. Surgeons also use minimally invasive techniques for many procedures now. These techniques involve smaller cuts, less muscle damage, and can lead to faster recovery times for patients undergoing these advanced treatments. Recovery from lumbar spine surgery is a gradual process. It really varies from person to person. It also depends on the type of surgery you had. In the first few days and weeks, you will likely experience some pain. This pain is from the surgery itself, but your doctor will help manage it. You will be encouraged to start moving gently quite soon. This might involve short walks. Full recovery, where you feel much better and can do most things, can take several months. Sometimes it can take up to a year for the maximum benefit to be realized. Following your surgeon's advice is key for a good recovery. You will likely be given specific instructions. These will cover wound care and activity levels. Physiotherapy is almost always a crucial part of rehabilitation. Your physiotherapist will teach you exercises. These exercises help to strengthen your back and core muscles. They also improve your flexibility and range of motion. It's important to be patient with yourself during this time. Do not try to do too much too soon. Listen to your body and progress at a steady, safe pace for optimal healing. The benefits of lumbar spine surgery can be truly life-changing for many. The most significant benefit is often pain relief. Reducing or eliminating chronic back and leg pain can make a huge difference. With less pain, your mobility often improves. You may find you can walk further and stand for longer. This can allow you to return to activities you once enjoyed. Your overall quality of life can see a substantial improvement. Many people are able to return to work and engage more fully in their family and social lives after successful surgery and diligent rehabilitation efforts. However, like any surgery, lumbar spine operations do carry some risks. These can include infection at the surgery site. There is also a risk of bleeding or blood clots forming. Nerve damage is a potential concern, though surgeons work carefully to avoid this. Complications related to anesthesia can occur, as with any major procedure. Sometimes the surgery may not fully relieve all the pain, or pain might return later. This is sometimes called failed back surgery syndrome. It is vital to discuss all potential risks and benefits thoroughly with your surgeon before deciding. This ensures you make an informed choice about your health and benefits